if we knew he had these issues, if they knew that this was an issue, why now are you just figuring out, and they went in and did a scope or whatever they do? We'll talk to Ian Beckles about it. He knows more about the scopes, I'm sure, than
Well, they went in and did a surgery. There was a surgery done, and then they found more damage than they knew was there, and then repaired that as well while they were in there.
Why was that? We'd have to talk to a doctor, I guess, at Florida Orthopedic Institute, but why was that?
Why do we just think of that now?
Right. Even that minor procedure that turned into finding more.
Yeah.
Why was that done so recently? Why wasn't that done earlier in the summer?
It's a good question, and it's one I certainly don't have an answer for. My assumption is, the only assumption I can make is that, so obviously they've looked at it, right? They've looked at his knee since the injury, since he played last season. Like, there's no doubt it's been looked at. My assumption is that they thought it was something that could heal without surgery, and that we would be at a point, as Todd Bowles said, that he'd be fine during training camp. Obviously, they realized that wasn't going to be the case, and they thought it was probably something minor they could go in and clean up, and maybe he doesn't F around much during the preseason. We don't really see him in the preseason, but he'll be good for week one. That was, I assume, had to be the expectation. Otherwise, why wouldn't you do it sooner?
And I get that assumption, but even with that, why wouldn't you do that minor procedure? Like, why would you wait to get that clean, whatever you needed to clean out? Why would you wait to do that to now?